I just want to have a close-up look at the skin.
Yeah.
The wee small ones look vascular. Okay, this really does not look like an eczema. Eczema would be a welcome relief, actually.
Yeah. No, not with me. No.
You give me this.
Yeah. So it's quite rare then.
This is not a common skin condition. This does need a little bit more investigation work. Hi, Hannah. Hi there. Come on in, I'm Dr. Emma. Tell me what you've come along with today.
I have a rash that comes up about 3 weeks of the month. It started off just a few patches on the backs of my legs, and it's now comes up all over my body.
Tell me the cycle of what it feels like. So there's nothing there, and then what happens?
And then I get itchy. And then when the redness comes up, I feel burnt. It's still itchy, but it's not a relief when I itch it. It's like scratching a burn. It doesn't relieve the itch. Eventually, you can see it's very dry on the top, and then when it disappears, it flakes away.
Okay. Do you take medicines for anything?
Yeah, so I had a heart transplant, so I take medication.
How old were you when you had your heart transplant?
I was 9.
So from the age of 9, you've been on your anti-rejection medications. So presumably you've had biopsies taken of this?
Yeah, biopsies of my skin, numerous treatments, but nothing's worked.
And you've had blood tests done?
Numerous blood tests.
Yeah.
What worries me the most is if it's something really serious that no one's picking up on.
Yeah, because you've had a lot of very serious things.
Yeah, so everything in my head usually feels serious, yeah.
Yeah, well, you are putting on a very brave face because you've actually been through a lot for somebody so young. I mean, it doesn't sound like the story you're telling me is just about the skin being dry and a skin barrier issue. It sounds a little bit more than that we kind of need to dig down and get to the bottom of. See what the rash is looking like.
Yeah.
Let's go and have a look at your skin. I definitely preferred your green shirt on you than that attractive outfit. And so when this rash comes up, does it ever come up on the arms?
Down here.
Oh yes, actually I can see.
Yeah.
So this feels very sandpapery. That's how I would describe that. So it's sandpapery dryness, and it's just starting round here.
Slightly, yeah.
And then you never knew this was a gym class, did you? It comes right up under the arm in here.
Yeah.
So this would go away entirely in the weeks that you're free. There's nothing there
There's
at
no
all.
roughness, no nothing. It goes like pure smooth skin.
Okay. So what we've got when we look at this is this sandpapery texture, and then you've got these almost circles appearing, and the colour of them is like a pinky red, but also a yellowy red to it. And then you've got these areas where it's just white in between the normal skin colour. Okay. I think Hannah's rash is going to turn out to be something that is quite rare, something we don't encounter very often. She's incredibly interesting. When we think back through her medical history, the heart transplant that she's had, overcoming blood cancer, and she's so bright in her outlook of things. And it's a shame that this skin rash is now the thing that is a bit of a hurdle for her.
Have you seen rashes like this before?
Seeing rashes like this are not uncommon. However, the story you're telling me about how this comes and goes, that is very rare. I mean, the first thing that comes to mind is, could this be related to your hormones in some way? And I think we really have to overly investigate that to find out. Or whether this is something that is a kind of neoplastic or a cancerous type of a change in terms of a condition called mycosis fungoides. So it is a type of a cancer that affects the blood cells that are sitting within the skin. I don't want you to worry that I've used that term, okay? Because this is something that we need to find out if that's what it is and exclude it. And if it is it, then in most cases, it doesn't go on to cause you any other problems, with effect on your life or anything like that, other than it's inconvenient because you have this rash that's a little bit like eczema.
Okay.
So we're going to get some more blood tests, we're going to do some biopsies, and then get all of that back, and that will give us more clues as to what exactly is going on here, okay?
Yeah.
Okay. I think with Hannah, she's just desperate to know what this is. Hannah has this mystery condition, and she's had a lot of dermatologists all over the country scratching their heads trying to work out what on earth is going on with her skin. I want to take a sample of her skin as a biopsy so I can look at it properly under the microscope and see what's going on.
I'm just used to there not being an outcome. I'm keeping my fingers crossed.
How are you doing?
Good, thank you.
Good. Well, hopefully this is going to give us a few answers to the medical mystery that is Hannah. So can I get you to wriggle your toes? Wriggle, 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 wriggle. That's excellent. So you know why we're taking this little biopsy. It lets me know what type of cells are there and how your skin is behaving in response to the cells that are there. Very good. Okay, I'm just going to check the area before we start. Do you feel anything sharp there?
No, I can't feel anything.
If we call this left flank. All done. So we're just putting some stitches in, and these ones will just dissolve away by themselves, okay? Okay, Hannah, that's it done. So we're going to send these off to the lab, okay?
Yeah, that's fine.
And we'll just wait for the results to come back and piece the jigsaw together, right?
Yeah.
See you then. Bye. It's not going to be easy, but I am renowned as being a bit of a terrier or a dog with a bone. The bone is not being let go until I work out what's going on.
I knew it was going to be complicated. Both conditions that Dr. Emma think it could be are both really rare conditions and hard to treat, so either way, it's not going to be a great outcome, but at least I would know and know where we go forward in treating it and me leading a better life with it.
So how have you been?
The same, very itchy.
Just the same.
Yeah.
So the results have come back, and in truth, it probably is falling down a little bit more towards this diagnosis of mycosis fungoides rather than this progesterone dermatitis. So mycosis fungoides is a type of a cancer where you have these white blood cells that come into the skin and cause inflammation and slightly scaly surfaces to the skin.
Okay.
And sometimes it flares a little bit and sometimes it settles down and doesn't cause any problems at all with the rest of your life.
Okay. Is it, I mean, could it get to a point where it gets worse and it alters my life expectancy? Would that happen?
In more than 95% of cases, no, not at all. So, no.
Mm-hmm.
Let me get you a hanky.
Just I really wanted it to be the progesterone thing, not the cancer thing, but...
I know. Let me just put this, then I can come in close to you. It's only a few of these cells that are being seen, okay?
Yeah.
So I want to reassure you that this is really not likely to go anywhere and cause problems elsewhere.
Yeah.
There's certain risk factors for it happening and you don't fit those risk factors.
I feel mixed. I'm glad I've got a result, but it's not the best result in the world, but it can be worse as well. So.
Yeah. At the moment, there's not a cure as such, but nearly everybody who has it, they just live a very normal life. It's a bit like having almost like an eczema where you have to put creams on your skin every day.
Yeah.
Does that make sense?
Yeah.
Yeah.
Good.
Good. I'm going to start you on a topical regime of treatments, and then also we'll think about using the phototherapy, so the UV, because then the good thing about that is it targets your whole body quite quickly, as opposed to having to put creams on everything. Okay. So that, you know, your life can just be the life that you want it to be, so that this doesn't hold you back and your skin is not sore. Okay. You just need to stay under our care, and we'll see each other once a year, but we don't expect it to do anything more than it's already done.
I thought it'd be more severe than that, you know, once it was diagnosed, but if it's not going to kill me, then I'm not worried about it.
Yeah, good.
Yeah, good.
This is a difficult condition to diagnose, and it's had a lot of people scratching their heads for a long time to get there. And then this rash that we really did at the beginning think was cyclical actually is a little bit more fixed than that and just flares from time to time. But because it is actually a cancer, there are some rarer cases where things can progress on, and that's why people stay under monitoring control by the dermatologists.
It's a relief to know that now I have a final diagnosis. The other cancer I had was a 10% survival rate, whereas this is a 95% of staying as it is. So, you know, it's a massive difference. Dr. Emma seems very confident that we can get a result on my skin. I'm really grateful that she's got to the bottom of what it is, and you go from there. You can treat it once you know what it is.
Hiya.
Hi, nice to meet you.
And you?
You want to come with me? I'm Dr. Emma. There we go. Come and have a seat up on the bed. What have you come along with today?
Well, I've suffered with psoriasis all my life, as far back as I can remember, from the age of 3, so my mother tells me,
Okay.
yeah. I've had various treatments over the years, light treatment, various steroid ointments, creams, different systemic treatments. More recently, I've been on methotrexate, which is an immunosuppressant, and no matter what happens, it always seems to come back more aggressively the older I get.
Do you get symptoms with it, Bud, as well? So does it feel itchy to you or hot or painful?
Yeah, definitely. As far as I'm aware, I do a lot of my scratching when I'm fast asleep.
Yeah.
Picking flakes off my calf, or...
So there blood on your sheets when you wake
Yeah,
up?
or a silhouette of my foot on the carpet.
So for you now, is your skin good, bad, or this is the way it just is?
Just worse than average.
So this is the kind of thing that you're used to just dealing with every single day?
Yeah. I had a bit of a skin infection as well.
Tell me about that.
The infection became uncontrollable. My whole body shed the whole epidermis. So all my hands peeled away, the bottoms of my feet peeled away. It developed into a full-blown erythroderma.
So erythroderma essentially is where our entire skin, the derma, is red, erythro. So you've got red skin. The problem is whenever you've got red skin all over is that your skin is not doing the job it's meant to do, which is control your temperature. And we need our temperature to be regulated to keep our internal organs regulated. And if those things aren't working, that puts us in an area where our organs can fail as a consequence.
They told me it was definitely life-threatening, and I'd never viewed my condition as that.
Oh, yes, that is considered a dermatology emergency.
Really scary.
What I do need to do is have a good look at everything. Is that all right?
Certainly.
Grant. Okay, you're suitably dressed for the occasion now. Let's have a good look at your skin. So we can see this plaque, and then it's got this scale overlying it. And it is actually taking up the vast majority of the back of that hand. So moving on up the arms. So these flakes are appearing because the skin is turning over much more quickly than it would normally do. So instead of growing in the space of about a month, it's doing its job in about 5 days. So it's making lots and lots and lots and lots and lots and lots and lots of skin. And that's why you get the kind of the dead skin layer coming away. And this is a very classic presentation of psoriasis on these extensor surfaces. So they symmetrically appear on the elbows. Okay, sit yourself forward for me, and I'm going to have a look at your back. Okay, and then scattered all over the back is the same thing, little raindrops of small plaque psoriasis. And then the legs, the skin itself is thickened just like the elbows, and then you've got this scale overlying it. Okay, so this is pretty extensive, isn't it?
Yeah, pretty much always has been.
And it's also pretty extensive given that you've been on these medications to try and reduce it or modify it. So we need to pick a medicine that's going to modify the disease enough that it stops these flare-ups and pain. Sometimes it's injections. They target a specific part of the pathway in psoriasis. Okay?
Magic. Good, yeah. Really positive. It would mean everything if we can find a solution long term, especially to give me the future that I'm hoping for.
tell me how things have been since we last saw each other.
I started treatment about 3 months ago with the new injections. By week 6, I was almost clear.
That is quick. I bet you couldn't believe it.
35 years versus 6 weeks.
By the time I'd had the second injection, you almost couldn't see it.
And how has that made you feel?
Amazing. Things have really turned for positively work-wise, be able to handle and react to stressful situations in a better way because I'm not already wound up because of the skin. Quality of life's improving as well as my physical.
That's amazing.
So, brilliant, yeah.
And what about your family?
I'd like to think they've seen me in a better mood most days.
You're honestly a chilled, cool cucumber now.
Very much so,
Because your skin is chilled.
Definitely, yeah.
Oh, I can't wait to have a look at your skin. Okay, good. Right, let's have a look. Should we look at these arms first of all? Look at that. I mean, really, hardly anything at all. A slight little glimpse, but I mean, perfect. And then let's have a look at the back, because that was a bit of an issue too. It's just completely clear, isn't it?
Completely.
Oh, I mean, look at this.
I haven't seen my knees for years.
That is amazing. And this has only been 3 months.
Yeah, it was like that after 6 weeks.
This is quite phenomenal. So I would say that the trial has been a success and we should continue.
I would agree.
Well done, Matt.
Thank you. I've dealt with psoriasis far back as I can remember. I'm finally at the point where I feel like I'm free of it and I can look forward. Really optimistic about the future. I can crack on playing the drums to get back into my sports.
It's just absolutely amazing. It means the absolute world.
So, Charlotte, what's been happening with your skin?
I've got this horrible rash on my leg.
Okay, so when did that first start?
Oh, like 10 years plus. And it's just got worse and worse and worse.
And describe to me what this feels like.
Very itchy, very sore. I get swelling in my legs. It's very uncomfy.
Okay, so it's really, really painful.
Yeah.
And are you worried that this is getting worse?
Yeah.
Yeah. Okay, and what about anywhere else in the body? Does it ever come anywhere else?
No.
And what has somebody told you the rash is?
Eczema.
Eczema.
Doesn't look like it. It's purple. It's like a bruise.
And what does it make you think whenever you see it?
It's ugly.
Yeah.
I don't want it. Try not to look at it.
So you're just ignoring it as much as possible?
Yeah.
Okay, tell me about your medical history.
I've got cerebral palsy, and as a result, I find walking difficult. I can easily tip over.
And you walk around with your stick?
Yes, mainly for balance, mainly for confidence, but yeah, it does help.
Okay, well, I'm just going to get you into a gown so we can
Yeah.
have a good look, all right?
Yeah.
Thanks, Rosie. So this has been like this for 10 years.
Not as bad as this, but it's been a good 5, 6, 7 years.
Looking like this, with this bright purple red edge to it. We've got these little circular, purple, slightly raised, tiny lesions. And then you've got this large plaque that is got a scale on top of it that you can see. It's the same on this side, but it's obviously smaller. But what's interesting, it is very symmetrical. You know it's in this exact same distribution. And we've got little kind of satellite islands of it heading up here. And it's the same on this side.
More worried about the swelling as well, especially this leg.
In this leg?
Yeah.
I can see that you do. I just want to have a close-up look at the skin.
Yeah.
The wee small ones look vascular. Okay, this really does not look like an eczema. Eczema would be a welcome relief, actually.
Yeah. Yeah. No, not with me. No.
You give me this.
Yeah. So it's quite rare then.
This is not a common skin condition. This does need a little bit more investigation work. There's something about the way that you've got these islands of them that are heading out that look more like something to do when there's inflammation around the vessels.
Okay.
We need to take a biopsy of this, and let's do some blood tests that will also let us see if there's anything in your blood that's inflaming these vessels. Those things will just give us a little bit more information as to exactly what's going on. Would you be okay with that?
Yeah, it's a relief. Because that does not look like eczema to me.
No, I'm not happy to accept that as a diagnosis.
Okay, and this one here, take a deep breath in again for me. 1, 2, 3. Good.
There's a few things about Charlotte that has me slightly worried, because when we look at her lower legs, these hard plaques are caused by a proliferation of the blood vessels. And aside from that, you also have some changes with some swelling within the skin, and you can see all of her veins very easily.
That's it, that's you done.
And we normally see these kind of changes in people who are much older, and I need to take a biopsy to find out what is going on, because this could potentially be very serious.
Oh, hello. Hello. How are you? This day has been massive for me. It's not eczema. Someone is finally on my side.
Okie dokie, that's nice to see you back.
Yes.
And the reason why we've got you back today is so that we can discuss the biopsies.
Biopsy.
And what we find is that this is a condition called acroangiodermatitis.
Right.
This is a very rare condition, and it's typically caused because of increased pressure within the veins further up the leg. They're not able to do the job of clearing the fluid back up again, which partly accounts for the legs being a bit swollen. So that increased pressure is causing the little blood vessels within the lower part of the leg to multiply and replicate themselves, and making these purple plaques that are itchy and that are really, really cosmetically very obvious. Now, these plaques that you have that are made up of the little blood vessels, they very easily start to break down and form ulcers very quickly. So what we really need to do is to start putting measures in place to start treating them as they are now to prevent that from happening. That will start today, actually, because this is in a state where we need to get this done urgently and quickly.
So I've caught it at a good time.
You've got it at a good time. So what we need to do now is put some creams in place and some compression stockings that you're going to wear each day. The compression is going to stop this extra fluid that's been gathering. It will also help with the actual plaques that you've got, the big red purpley plaques.
So happy that there is a treatment and I am going to get sorted. And it's not eczema.
You knew.
We knew.
So I have somebody from our compression team here. So we'll get you into a gown and then we'll get Adam in to start doing all of the compression workup, okay?
Yeah.
Great. This disease, if it was allowed to progress, will end up with pretty awful ulceration, and it'd be quite catastrophic for her. This is Adam, who I was telling you about. So it's so important to start the treatment today so that she doesn't end up with leg ulcers and infection. And things like that can then lead to things like sepsis, which is very worrying. Even since we last met, these legs are more swollen. And look, you can see where there's been little superficial erosions and ulcerations starting to appear. But actually, you're starting to see those changes very quickly in just a few weeks. So I'll hand you over to Adam to get this sorted, okay?
Yeah, thank you.
Over to you.
Charlotte, we have a pair of stockings here. So here we go. I'm going to take the stocking here and we need to thread it over the foot. So we're literally applying a V shape of pressure. It's pushing everything back up. It's going to help the blood get back up to the heart. Make sense?
Yeah, makes sense.
Okay. So you see here at the top of the grip top, the grip tops are sewn on. So the last thing you want to do is yank it by the grip top. So always say,
Flip it.
just to turn it round a little bit like this, and then you can use as a handle.
Yeah.
Okay, so do you feel able to have a yank of
Do you
that?
wanna try? Yeah.
Obviously, you have to get underneath your leg.
Oh,
Lady.
very good, Charlotte.
That's
That's
you are
great.
ready for an
Expert in the stockings. Okay, how does that feel?
Now the pain's gone. Itchiness
Yeah.
is gone. Yeah.
Okay.
So this is about providing support and pressure to those deep veins for right now to stop this progressing, and this is the answer. I'll also be giving her some creams, and these creams will calm down the inflammation that's there. And then we'll be able to gradually reduce the pressure of the stockings that she has to wear.
Oh, hello. Oh, hi, yeah, you okay?
Yeah.
Come here. How'd you get on?
Bit shocking.
Shocking.
Yeah, it's not eczema. It's to do with my veins. Dr. Emma said it's a good job I caught it now because I could have had it a lot worse. It's more serious than we thought.
Okay, Charlotte, how are you?
I'm not too bad, thank you. How are you?
Good, thank you. The last time we saw each other, you were having the compression stockings fitted.
They are marvellous. I hardly have any swelling, to be honest, now. I still get a little pain, but I expect that. Now my rash is a lot better. It's a lot lighter, it's a lot smoother, it's not as bumpy. I've actually got hair growing from it. So I've actually finally shaved.
Yay! That's amazing. I got the photographs that you sent through.
Yeah.
And actually, I can see the hair. The hair you can see really, really clearly. And it's gone from that purpley colour, which is the active disease, to this flat brown colour. So that's all really good. And how are you finding wearing the compression stockings?
Sometimes I don't feel them at all. Sometimes I can come down. So there's a few times at work I've had to go, oh, can I sort my stockings out? They are really, really comfortable, and I really like them, actually.
Are you feeling a little bit better about yourself whenever you see your legs now out of the stockings?
It doesn't look like my leg's going to fall off. I can move my ankles and it's not going to crack. So, yeah, at this part, I am really happy.
What does your husband say?
He's actually touched it a few times, which before that, I wouldn't let anyone touch it.
I'm really pleased that you came whenever you did, because you came at just the right point, because this was shifting in the wrong direction. And you've started the treatment, and you've been diligent with the treatment, and that's why you're seeing the big differences.
Yeah. When you said last time I seen you about the ulcers, that really scared me.
But the journey doesn't really stop here, because you will continue to have the stockings, which you now love. I think all the hard work you've put in right now has actually saved you from a lot of trouble.
Yeah.
If you continue to wear these stockings, this will completely clear up. It will go.
Stockings all the way.
Stockings all the way up.
Yeah, all the way. Thank you so much.
Take care. Bye, my pleasure.
Thank you.
Bye.
Bye.